Hi, are you someone who find difficult to maintain your balance, or you feel uncomfortable when you have to constantly look at one place? Are you someone who feel dizzy often? Are you someone who feels some sound coming inside your ear? Sometimes you feel that you are losing your balance? Then in all of these scenarios, you are having some or other type of vertigo. Well, vertigo can be of different types, different varieties, and can come from different causes. But one thing that is common among every individual is lack of stability. Yes, you heard me right. You feel that something is missing in your balance system, and that gets aggravated whenever you are trying to fix your eyes in one position. Or else whenever you are trying to turn suddenly, you feel that there is some sort of discomfort that's happening in terms of your stability. Now, if these are the symptoms that you are experiencing, then I have some very interesting exercises for you that will help you out. So, if you are someone who is suffering from vertigo that's related to BPPV, cervicogenic vertigo, or vertigo due to Meniere's disease, these are the gaze stabilization exercises that will help you out. So, make sure to watch this exercise. We have divided these exercises in 3 video series so that you can cover all aspects of it. Today, we will be showing you head and neck movements, and these are the beginner level exercises that you can do for your vertigo. Let's get started. So the first exercise here we will start with will be keeping the neck stable, moving the eyes up and down. So you need to look up and then slowly look down. We will do this for 5 counts. 2, down, 3, down, 4, down, 5, down, and relax. Now we will look side to side. So you have to turn your eyeballs towards your left and then rotate your eyeballs towards your right. Left, right, left, right, left, right, left, and right. Relax. Now you need to cross your eyeballs. So look from down and diagonally up. 1, 2, 3, 4, and 5. Similarly, we'll do the opposite. 1, 2, 3, 4, and 5. Relax. So this was the first set of exercise. You can rub your hands and dab your eyes just to calm them down. So now let's move on to the next set of exercise. For this, place your one finger in front of you. Now you have to move your finger up and down, and you have to track your finger up and down without moving your neck. Let's get started. Look up, make sure to keep your neck stable, and look down. 1, 2, down, 3, down, 4, down, 5, down. Now similarly, you have to place your hands in front of your face, and you have to turn your hand towards your left and right, and you have to track your fingers without turning your neck. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Relax. Now you have to move the finger closer to your body and then away to your body while you are tracking your fingers without moving the neck. So keep your hand in front. Now bring the finger towards your body. Keep gazing at your finger and now bring it in front. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. Relax. Now let's move on to the second part where we are going to do head movements. Now in order to do this exercise, you need to keep your eyes open and bend your neck forward and backward in a pain-free and relaxed manner. Make sure that your eyes are open, gently bend down and then look up. Now in any point if you feel dizziness, vertigo, just be in that same position for some time and then move on. 2, up, 3, up, 4, up, 5, up, 6 and relax. Now very similarly we have to turn your neck side to side. So turn the neck from one side to other. 1, back, 2, back, 3, back, 4, back, 5, back, 6, back, 7, back, 8, back, 9, back, 10 and relax. Now we have to rotate the neck from side to side in 180 degree, keeping the eyes open. So rotate the neck. 1, 2, 3, 4 and 5. Similarly, you will rotate the neck from up one side. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. Relax. Now we will do the same movements with eyes closed. So make sure to close your eyes. If you feel that this is aggravating your symptom, then wait, just continue with your eyes open exercise. But when you feel that now you are comfortable with eyes open, then you can progress it to eyes closed. So close your eyes, bend down and look up. 2, up, 3, up, 4, up, 5, 6, 7, 8, 9 and 10. Relax. The second exercise will be turning the neck from side to side. So keeping the eyes closed, turn to one side and then to other. 2, 3, 4, 5, 6, 7, 8, 9 and 10. Relax. Keep your eyes closed, side bend and back, 2, back, 3, 4, back, 5 and relax. Now we need to turn the neck and do a half circle. Turn the neck to one side, bend down, 2, 3, 4 and 5. Similarly, with eyes closed, we'll rotate the neck from up side to side. Eyes closed, look up, turn one side and then another. 2, back, 3, back, 4, back, 5 and relax. So friends, these were some simple exercises, gaze stability and habituation exercises that you can do when you have got vertigo of any sort. But there are some red flags that you should keep in mind. Red flag number 1. While doing any of the exercise, if you feel that your symptoms are aggravating or increasing, pause there. Stay in that same position for some time till the point you feel that that vertigo or any kind of discomfort just goes away. Remember, these are habituation exercises. You don't need to improve your strength here, or you don't need to push yourself here. You just need to make sure that you bring yourself in the same position again and again so that you can get habituated to it. Number 2, this exercise can be progressed as you start. So it's not necessary that while you're doing all this exercise, you should start at one go and follow all the exercises. You can start with simple eye-open exercise and then gradually progress. Feel free to add or minus the exercises depending on your condition. Number 3, vertigo can aggravate sometimes and can give very bad symptoms. Hence, it's very important that you take help of physical therapist while working on your vertigo rehab. Please don't consider this exercise as the only treatment for your vertigo. Vertigo is a complex problem and needs to be addressed from a multiple layer. Hence, it's very crucial to work with expert. So friends, I hope these exercises were helpful for you. In upcoming videos, we'll share some more insightful exercises. So make sure to stay tuned with us on our YouTube channel, HealthQ. Thank you.